You know, it certainly makes all of us wonder if our hospitals here are prepared to handle such an incident. And you spoke with IU Health officials this evening.
Well, that's right. And the most comparable incident that we've had here in Indianapolis was the State Fair stage collapse. That happened 5 years ago this August. In that incident, 7 people died, 58 were injured. Medical teams here train year-round, so they're ready for the next Code Red. The trauma medical director at Methodist knows mass casualty events well from her time in Afghanistan and Iraq in the Air Force.
It's awful to know that these people are suffering and their family don't even know.
When someone is shot, she says the key is to stop the bleeding and replace blood loss ASAP.
The bullet has respects no boundaries, and depending on the weapon, I think one of the weapons was a high velocity weapon, so they can cause quite a bit of damage, not just the bullet itself, but the pressure effect of the bullet passing. And so those patients require a lot of care in terms of operations to fix holes in organs, bleeding blood vessels. I'm sure many of those patients probably had multiple gunshot wounds, so it's not even a single injury that has to be fixed, it's multiple. It's really labor intensive to save their lives.
And the medical team can remain taxed days after patients arrive.
I think what we learned in the State Fair stage collapse is in the first 24 hours we did a great job. Everybody was up all night. My physicians were working. They needed food. They needed to check on their families. They needed to eat. They needed to sleep. And then it didn't stop because the next day the patients are in the intensive care unit and still needed intensive care.
Methodist is a level 1 trauma center training year-round with drills for a surge, a Code Red. They have on hand 1,000 units of blood, 11 trauma surgeons, 29 operating rooms.
We're prepared for it, but you're never 100% prepared for something like that. So in the moment, you just do your best.
Here, they understand the pressure their medical peers in Orlando still face today.
To get 27 patients of varying degrees of critical illness, all with gunshot wounds, that's a huge stress on the system. I'm sure that they jumped to action immediately, and it's hard work. I'm sure they're still working today to save lives.
And another lesson learned here from the stage collapse is the importance, if when possible, identifying the patient at the scene before they head to the hospital. That way families get a clear direction on where they can find their loved one.